wee bit ago, Kathy joined us. Dr. Andersen joined us, and she has started taking hotline calls, and she became a go-to person. So as soon as a call came in, if there was a walk-in, we have both people who call in and people who walk in. Well, as soon as there was a walk-in, we sent Kathy. She became that important to the mission of our section of the whole program of the YWCA. Our section was for violence intervention and prevention, which includes domestic violence, sexual assault, and human trafficking. So that was where Kathy started, and she sat right across from me, became very annoyed with me, and moved way across the room. She was such an important person on our floor of 20-some people on the floor, that we asked her to serve as our education person, to go out into the community and teach what is the mission of the YWCA. And she has been doing that for some time now. And then the supervisor's position became open, and she was asked if she would take on that role as well. So she has many hats, and she has served to assist me on calls and figuring out how to help people in this terrible crisis that they wind up in. So I introduce to you a servant who I admire greatly, Kathy Andersen.
Thank you so much, Fred, for the kind words. I greatly appreciate it, and mutual admiration, Fred.
Thank you.
So right now, I will get started with the presentation, so I'm going to share. And I'm just getting things set up. So basically, greetings to the St. Stephen's Episcopal Cathedral community members, Reverend Canon Fred Miller, my co-presenters, and the rest of the community. My name is Dr. Kathy Andersen, and I am the Education and Outreach Team Leader at the YWCA Greater Harrisburg. I am here for the presentation titled COVID, Domestic Violence, in order to cover surviving societal ills. Now, before we move forward, I just want to cover the objectives that will be happening throughout this presentation. What is domestic violence and the data behind it? Healthy and unhealthy relationships, red flags and consequences, COVID, and violence against women. You may notice the acronym with the initials VAW. That means I am referring to violence against women. COVID and risk for violence against women. Ways to address violence against women during COVID. Important phone numbers and resources, as well as questions and discussion. Now, I also want to highlight that during this month of October, it happens to be Domestic Violence Awareness Month. So this is obviously perfect timing regarding this particular session and this topic. On my end, I noticed an email newsletter from the Safe Havens Interfaith Partnership Against Domestic Violence regarding this important awareness month. Now, according to the National Coalition Against Domestic Violence Awareness Month, it started as a day of unity back in October of 1981. Then, just to provide some historical background or a guideline or a timeline, in 1987, it became Domestic Violence Awareness Month. And then in 1989, Congress passed legislation to make it official as Domestic Violence Awareness Month. The purpose behind it involves mourning those who died from domestic violence, as well as honoring those who survived, while raising the awareness of the issue and working to end domestic violence once and for all. That is the overall goal, is to end domestic violence once and for all. Now, in terms of what is domestic violence or dated violence, it is basically a pattern of violent and coercive behavior where one partner in an intimate relationship controls another through force, intimidation, or threat of violence. At the same time, please keep in mind or note that this may cause the victim to stay for various reasons. Now, you will notice this graphic capturing a vicious cycle. This vicious cycle captures what happens regarding domestic violence or dated violence. Now, before I get started with this cycle, yes, it can happen for various reasons. It can happen due to economic, in terms of why the victim may want to stay in the relationship. The victim may be blackmailed, therefore forcing that victim to stay in the relationship. There may be kids involved. There also may be other family members involved, including elderly relatives. But please keep in mind that when any form of violence happens, whether if it's domestic violence or dated violence, it is never, ever, ever the victim's fault. So, in terms of this particular vicious cycle, this yellow, you may not be able to see it as clearly, but this is titled the pursuit phase. In other words, it is the beginning of the relationship. It seems that everything appears to be perfect and rosy. And then the honeymoon phase, in which things continue to be fine. The couple remains in love with each other. They're happy with one another. And then all of a sudden, it may involve something as simple as someone accidentally spilling a cup of coffee on the table. And all of a sudden, the other partner becomes angry about it. And that starts to build up that anger. And that buildup of the anger leads into the standover phase, in which things start to get confrontational. There may be yelling, name calling, various arguments, to the point that it leads to a physical domestic violence or dated violence incident in the form of an explosion. And once that explosion or that particular dated violence or domestic violence related abuse happens, then the offender involved with the confrontation appears to be remorse, may say, hey, I did not mean to do this. That was not my intention. I am so sorry. And that offender might say, it won't happen again, I promise. And based upon what I previously mentioned in terms of the various reasons why the victim may decide to stay in the relationship, in terms of economics, being blackmailed, kids involved, and other family members involved, then that victim decides to give the offender another chance. So basically, I just captured this remorse phase. And after that remorse phase happens, then the vicious cycle continues to start over and over and over again. Now, let me move forward to the data. How many victims are involved? Well, basically, 1 in 4 women and 1 in 7 men at the age of 18 years or older in this country, the United States, have been the victim of severe physical violence by an intimate partner in their lifetime. Also, in terms of additional data, more than 1 in 3 women and 1 in 4 men in the United States have experienced rape, physical violence, and/or stalking by an intimate partner in their lifetime, which is very alarming, especially during the time of COVID, which I will get more into later. Now, in terms of the red flags, what this abuse may look like. Well, the offender may be checking the victim's cell phone or emails. That offender may make that victim feel bad about herself or himself. After all, this can happen to any one of us. There can be extreme jealousy or insecurity on the side of the offender. There's that explosive temper, maybe in the form of screaming or throwing things or engaging in more physical violence. There can be cases in which the offender starts to isolate the victim from family or friends, In other words, the offender may say, you're not allowed to even talk to this family member, or don't you even go near your friends anymore. Making false accusations, mood swings on the part of the offender, being possessive. No one else can be near the victim unless the offender is around. And even if the offender is around, there may be a certain series of expectations for the victim to behave, act, or talk in certain ways. Telling the victim what to do. Going back to that victim may only be able to go outside for, let's say, 5 or 10 minutes, and that victim better be back at a certain time period or else. As well as pressuring the victim to have sex. These are the red flags of what abuse looks like. But I also want to talk about what is considered healthy and unhealthy in terms of relationships. For healthy relationships, it involves communication, two-way communication that I should bring up, two-way. Boundaries, respecting each other's personal boundaries and space. Trust and respect from both parties. Respecting one another's self-identity, allowing the other person to be his or her own individual, as well as setting up realistic expectations. It's okay to talk about the likes and dislikes, as long as it is in a calm, non-confrontational, and non-violent manner. Now, what's unhealthy is obviously some of the red flags that I've just covered, included physical abuse, emotional or verbal abuse, financial abuse, stalking, as well as digital abuse, which can be a separate topic in itself in the form of unwanted or excessive texting, unwanted website service, signups, sharing or forwarding inappropriate photos of someone without consent, posting or faking or altering images or photoshopping images with the pure intention of hurting the other person. So those are some of the areas involved with digital abuse. And again, that can be a separate topic to talk about within itself. But at the same time, there are consequences involved regarding the abuser side, regarding the offender side. It can involve ending the relationship or dissolving the relationship. There can be legal consequences, which I can get more into later on. There can be charges, which would go on that abuser's record and follow that abuser for a long time. Imprisonment, placement on the abuser list, especially if there's photos involved in the case of minors, or especially if there is abusive behavior in the case of minors. Loss of reputation in terms of job loss, financial aid, as well as becoming ineligible for certain programs, whether if it's college admissions, financial aid, or even civil service jobs. Now, at this point, I would like to cover the other layer that is involved with domestic violence or violence against women, and that is COVID in terms of this pandemic. Now, yes, recently we have heard about this in the media. The rest of the presentation, as I just mentioned, covers the different aspects involved based on serious announcements from certain organizations and professionals, such as the CDC, also known for Center for Disease Control, the WHO, also known as the World Health Organization, as well as other medical practitioners known for providing respective guidance to us all. Now moving on to the COVID risk of VAW, or violence against women. And this is from the World Health Organization. Basically, it involves disrupted social and protective networks on the part of the offender. It also involves distancing measures impacting women, as well as victims of the violence, of the domestic violence, because after all, before COVID, before the pandemic, we used to place emphasis for the victims to stay in touch with their support systems as much as they possibly can. And now with the distancing measure in place, that kind of interferes with that support network for victims of domestic violence. Also, there's limited contact with family and friends regarding violence against women. In a way, that's the offender taking advantage of the situation and imposing that power regarding the victims. Also, in terms of the VAW, or violence against women's aspect, again, offenders are using COVID to manipulate the situation. And just to add more additional ways offenders have been known to manipulate the situation, it can be in the form of interfering with the victim in terms of their jobs. It can involve limited supplies that the victim may need, like all of us, such as soap and sanitizers. Or some abuser may spread false information to the victim so that the victim continues to have limited access, not only to that victim support system, but also to electronics in terms of communicating with that support system. And that is such not only an unfortunate situation, but also a dangerous situation as well during the time of this pandemic. Now, I also want to go into the physical evidence involved with violence against women. And this is based upon information that I noticed through WebMD. And WebMD ended up posting an article from a journal titled Radiology this past summer. August 13th was the publication date. And it involved a 9-week study on radiology scans. And based on that study, the practitioners noticed that 26 patients ended up with apparent wounds or serious abuse resulted from violence against women. Now, with that alarming statistic, keep in mind that this happened during the time period of March 11th to May 3rd of this year. And it happened at a well-known hospital in the Massachusetts area. And with this alarming statistic within that time period from March to May, involving 26 patients who became victims of domestic violence, that is comparable to close to the 27 domestic violence patients during the same weeks in 2018 and 2019 total. So this particular study captured how women who are victims of violence are impacted even more during this pandemic involving COVID. Now, at the same time, the governing bodies, the various parties, are addressing VAWA during COVID in the form of government and policy lawmakers, finding ways to make sure things are safely accessible for victims who come forward. In terms of health facilities, being available remotely through hotlines, shelters, rape crisis centers, as well as counseling. Health providers becoming more aware, and provided support through empathy, listening, non-judgmental, asking questions about needs and concerns. Humanitarian response provided services to victims, especially women subjected to violence. Community members increasing awareness for the purpose of supporting women and provided information. And even through the pandemic, trying to establish different types of network for women going through violence so that they're able to safety plan and get better access to the services. Now, in the meantime, I want to provide important phone numbers regarding information that victims can use, whether if it's you or someone you may know, in terms of sharing that information. Again, I'm from the YWCA Greater Harrisburg. We offer services 365 days of the year, 24 hours a day, 7 days a week through our hotline. This is our hotline number. Also, for other important numbers, here is the National Domestic Violence Hotline number, 800-799-SAFE. SAFE captures the last 4 digits, 7233. Also, some victims may not feel safe to make the call. They may ask someone that they trust to call on their behalf. They may have access to electronic devices in which they may be able to access the online website in terms of www.thehotline.org. They may use their electronic devices to text 222-522 or Love Is. Or they may be able to call this hotline.org number if they feel safe, 1-866-331-9474. Now note, if you are in immediate danger, whether if it's you or someone you may know, immediately contact 911. Now also, I'd like to go over certain resources offered by the YWCA Greater Harrisburg. Yes, we offer free and confidential, safety-focused and victim-initiated services, including individual counseling. We offer the domestic violence emergency shelter. We provide advocacy and referrals. We provide information and referrals. We're heavily involved in protection orders. We assist clients in obtaining an emergency protection from abuse order so that they are able to obtain it and then attend victim witness through domestic relations and get a longer-term order in place. We provide legal and medical accompaniment, safety planning, as well as relocation assistance. Now, I definitely thank you for attending this particular session. And at this point, I will make it safe to assume that there may be a certain round of questions later on or at a certain part of time during this program.
I might add a comment in that to say that just last week, everybody listened to my sermon. But I did make this comment in my sermon that our domestic violence shelter is often full. And we often have to send our clients to shelters in other counties in the area just because we're full. And of course, they do the same. They'll send people our way if we have space, but ours is so often full in my experience that it's such a shame. The other thing that is interesting is Mid-Penn Legal, which we use all the time, is right next door to the Cathedral. And we use their parking lot on Sunday when we do have services. And Saturday night when we are presently having services. So it's those two things I wanted to bring to people's attention.
Thank you.
Hi, Fred. Bob Coleman here. I'm interested that you're full, and I'm wondering if the occupation rates are higher now than they would be in a corresponding time, say last year or the year before.
Kathy, I'll turn that to you.
Sure. Now, as mentioned, yes, there are multiple times in which our shelters ended up being full. And I will say this, it has heightened or increased the calls and requests that we received for services. So due to the pandemic, we have been getting an increase in phone calls as well as walk-ins. And what we have continued doing is to provide other referrals to other shelters. But as Fred mentioned, it is very difficult because now, given that the victims that do stop by or call, they are in a worse situation than before due to the pandemic.
Short follow-up, if I could. One of the things that's popped up in the general press is the concern that victims of domestic violence may, during lockdown time, in effect, find themselves locked up with their abuser and have even less access to out of residence resources than they would have had before. Do you think that might be true?
I do, because of the intimidation factor that's involved, because of how victims may feel constantly threatened on an ongoing basis. I mean, most likely it can happen basically 24 hours a day at this point.
Kathy, I have a question, a couple of questions.
Sure.
What is your capacity?
What is our capacity?
for victims. And I do know, I believe that you do take the children as well. Is that correct?
Okay, yes. When there are available openings, and if victims happen to have children, we do take victims and their children. Now, every now and then, as I've mentioned in the presentation, any one of us can be a victim, whether female or male. So if we happen to have a male as a walk-in, then basically what can happen at this point is we would make sure that we get that male victim into one of the local area male shelters. We would still provide the services, but we would just make sure that male victim gets to a safe shelter for men.
I would also add, since I originally started at the YWCA working in housing and homelessness at the Y, and we were coordinating the work of 109 beds at the Harrisburg facility alone. Now, there are other facilities within Harrisburg, and of course, going beyond that in greater Harrisburg. The YW actually has specific responsibility for Perry County. And there is a shelter in Perry County, which our employees are there taking care of that shelter as well. So it goes beyond the 109 just at the one facility. But 109 beds, come on, we got to do better than this. That's terrible.
Fred, I do understand. This is Kathy Ann, and it was several years back that I did go to the Y seeking shelter from an abusive situation, was not able to be served there. Thankfully for me, I was a member of a women's group back then, and one of the women took me in so that at least I could take a medical leave from work and try and sort this out. But you're correct. If there's no housing available, it can be challenging sometimes, especially when you're already feeling terrorized, to come up with other resources. And, as a result, my ex went and put emails all over to every single person I knew saying that, I'd have this mental health breakdown and that, and had my whole family and everyone else really scared and upset. And so those are experiences that once you've had them, even though it was many years ago, it's still there. And so I think it's important that people understand that trauma, which is what this was, you continue to live with it. Maybe live with it in a healthier way, but you do continue to live with it after people have gone through these experiences. My own sharing.
Kathy, would you go into how many, not how many, but the work that the Y has for ongoing counseling for victims who have been through childhood experiences, even as adults? Here they are at the Y. Would you have anything more to say about that?
Sure. Yes, we do offer individual counseling services. And yes, we offer to not only adult victims, but also child victims. And at the YWCA, we also provide not only legal referrals, but also counseling referrals. And what would happen, we would, complete the information, and we would make sure that the victims would receive a follow-up call to start setting up the appointments. And we do have designated counseling space so that our advocate counselors can meet with the victims, whether adult or child victims, to provide the counseling services.
What about the financial aspect? Does the victim pay to the extent that they can, or how does that work out with the counseling and the medical services?
Okay, in terms of the counseling services, I just want to, stress that these are free services that the victims and the child victims receive as well. The services are free.
Mhm. Good.
Yes.
I just had a comment too that as far as making people aware of this problem, I was at Hershey Medical Center last week to visit a dermatologist, and in that department on the back of the restroom door was a big poster for domestic violence questions, so that the victim could determine when they were victimized and with the telephone numbers to call. And I assume that's in all the departments, but I thought that was a good service that they were providing. As far
Kathy,
as
would you also emphasize the work of the work of the Y at hospitals, and how the medical care for sexual assault people, that's a free service?
Yes. In terms of the medical accompaniments, we work with the local area hospitals. We work with UPMC, Harrisburg Hospital. We work with UPMC Osteopathic. We also work with Penn State Hershey Medical Center. And what would happen, someone from the emergency department will call one of us at the YWCA Greater Harrisburg and let us know that there is currently a patient who happens to be a victim of domestic violence or sexual assault. And then they would request for one of us to, before the pandemic, stop by the medical facility and sit down with the victim and provide services and information and whatever assistance that client may need. Now, during the times of the pandemic, we would handle the medical accompaniments by phone at this point.
Hi, Kathy. I'm wondering if I could ask your the view you have of how churches, synagogues, other religious organizations can best be supportive of your domestic violence work, one. And two, are there any churches, synagogues, or other religious organizations with whom you have currently productive relationships?
Okay. Yes, there are other religious institutions in which we do have productive relationships throughout Dauphin and Perry counties. I believe this past year before the pandemic, we provided training sessions to different religious institutions.
One of my responsibilities was to call every parish and religious organization in Dauphin and Perry counties. So I had a whole list of everybody, calling everybody to, and Kathy's gone out, I'm sure, and I've gone out to many different churches and other organizations.
Short form of what I was asking, how can we best help you?
Well, I would say just to continue to spread the word about the YWCA. Now, Yes, I have done my share of outreach, especially to the religious organizations, and I will probably do another round of outreach as well in terms of providing information and materials, whether if it happens to be in the form of brochures or in the form of call sheets. And when I do deliver the information, then basically people from the religious organization, they have been great at making sure they post the information, they keep the information, you know, with them or at the office area in case they happen to interact with someone who decides to speak up about being a victim, and they make sure they can get our resources and provide that to the victim or assist that victim in connecting back to us.
Fred and Kathy, do you work with the schools? I'm thinking of St. Stephen's right now, whether or not the people who treat children and observe children report or encourage people to use the YW services.
That's a great question. And I will say this, before the pandemic, yes, we would go into religious or faith-based educational institutions to present information. We do have curriculum materials involving body rights, involving bullying, involving healthy, unhealthy relationships. We also cover topics of domestic violence and sexual assault to high school students as well. And during this pandemic, just to let you know, I have done a series of Zoom recorded video presentations to different school districts throughout Dauphin and Perry County. And as a matter of fact, I'm scheduled to submit a series of Zoom video presentations within the next couple of weeks.
Just to reassure folks, or as a point of information, the school has a board member who is also a parent who works for the Y related to this program. So I'm pretty sure that the school has a conduit for this kind of information as appropriate.
Yes, and thank you for that. And also, in addition to that, I have been doing my share of outreach to the respective school districts, as well as private school organizations throughout Dauphin and Perry County.
Kathy, sometimes I hear people in relationships like you describe who are reluctant to take advantage of your services because they say their partner can change, that they can be reformed. I guess my question is that true? I mean, is it possible for somebody who engages in various types of abusive behaviors to be rehabilitated or to be reformed?
I will say this. We mainly deal with the victims. Now, every now and then, we may receive inquiries on the offender side. And if that is the case, we do provide some information and resources for the offender to use in terms of following up with certain programs of that nature.
But we send them elsewhere.
Yes.
We
Yes.
just deal with the
victims.
Would you say something, Kathy, about our mission at the YWCA begins with eliminating racism? How does that relate to the work that we do in violence intervention and prevention?
Yes, in terms of the eliminated racism piece, basically racism along with sexism, along with ableism, along with classism, and I'm just naming a few examples, happen to overlap or intersect with the domestic violence, the sexual assault violence that happens. So that even magnifies or even worsens the situation even more for the victims.
And would you say that one of the basic elements of all of those things is control?
Oh, it is definitely control.
To experience life-changing power of God that will free them from guilt, shame, negative thoughts, and addiction.
Yes, it is definitely control. It is definitely manipulation. It basically captures and magnifies the cages of oppression.
I want to be respectful of everybody's time, so maybe one more question.
Kathy, have you discovered that it's got to be harder for you to do what you do at the shelter in COVID times when you have people coming in randomly and it sounds like you're full in what's probably a congenial way when you don't have to worry about COVID precautions? The things that you cannot do at the shelter itself because COVID makes it impossible or too hard?
Okay, well, based on the guidelines between the World Health Organization and the Center for Disease Control, we have measures in place. So if there is a walk-in, that walk-in has to get scanned for temperature checks. We have to get scanned for temperature checks. We make sure we implement the necessary precautions, whether if it's social distancing, as well as ongoing constant mask wearing. And we encourage that not only among ourselves as staff and employees, but we encourage that to the residents in the shelters, as well as our visitors. Everyone must wear a mask and follow the COVID guidelines, especially set by the governor of PA as well.
Well, thanks, Kathy, for such a stimulating discussion and a great discussion this morning. And thanks for joining us. Next week, Megan Yost is going to be leading a session on neuroscience and prayer. So Megan, do you want to say a few words about that as to whet our appetite?
Sure. So I'm a psychology professor. The brain is not my specialty, but I've been really interested in how prayer and meditation affects the brain through a first-year seminar that I was teaching a few years ago in particular. So I'm planning to show some brain imagery studies and then walk us through a couple of different forms of prayer so that we can think about how we feel those different types of prayer or meditation impacting us on a psychological level. So it'll be a little bit interactive.
It sounds terrific. So invite your friends and come on. Megan, next week, same time, same place. And thanks everyone for coming and enjoy your Sunday.
Thank you.
Thank
Patty.
you.
Thank you.
Thank you all. Good to see you.
See, they know how to send. I did it. Leave.